For this presentation, we will be going over medical terminology. This is a very quick overview. I just wanted to give some kind of an overview for those of you who have not taken anatomy or kinesiology in the past, so that you would have some idea of what we were talking about. This is an extra credit presentation, so if you watch this presentation and you take the quiz afterwards, then you are eligible to get extra credit points for that quiz. Some very important medical terminology definitions are orthopedic. So orthopedic refers to bones, joints, or muscles. So if we're talking about an orthopedic surgeon, that's a surgeon who specializes in surgery to the bones, joints, or muscles. A tendon is tissue that connects muscle to muscle or muscle to bone. A ligament is a type of tissue that connects bones to each other. Fascia is a special kind of tissue that connective tissue that runs throughout the body. So if you were to take a piece of raw chicken and peel it open, like a chicken breast, if you peel the chicken breast apart from another part of the chicken breast, you'll see a white filmy covering both on the chicken breast and between the different muscles of that are encased in the chicken breast. That is what we're referring to as fascia, is that white filmy tissue. It connects muscles together, it connects muscle fibers together, it allows muscles to work in conjunction with other muscles to form body movements, it connects our skin to our muscles, so fascia is very important. And then cartilage. Cartilage provides cushion in the joints and also reduces friction on the ends of long bones. So when we're talking about different motions in the body, our starting position is always what we call anatomical position. So that is the position shown here in the drawing. This drawing actually cracks me up because it looks exactly like one of my old rugby players. Like if you were to make a caricature of him, that is what it would be. But this is our reference position. This is where we talk about the person moving from when we talk about movements. So it's head forward, palms up, feet down. We always want to make sure we're using the patient's right and left. So the hand that you see on your left is actually the patient's right. So that is the term that we will use, is the patient's right. Directional terms help to name some important landmarks in the body, and it will also help us to name some movements as well. So from this anatomical position, we have some reference term definitions. So midline refers to the middle of the body, so close to the middle of the body. Superior refers to up or above, where something would be. Inferior is down or below. Medial is close to the midline of the body. So midline is just straight down the middle of the forehead, straight down the middle of the nose, down the middle of the lips, down the middle of the chest, belly button, groin, all the way down to the middle, in between the feet. Lateral would be away from that midline. Proximal would be near the trunk, so your shoulder is proximal to your wrist. Your hip is proximal to your knee. Distal would be away from the trunk, so your ankle is distal to your knee. So we have some terms for body positions as well. If we refer to somebody as being supine, that means they're on their back. If we refer to them as being prone, they would be on their stomach. Side lying, lying on the side. If we are talking about an exercise being performed with a double leg stance, that means 2 feet on the ground. Single leg stance would be 1 foot on the ground. A split or a stagger stance would be 1 foot in front and 1 foot in back. Some general directional terms when it comes to movements of the body. Flexion would be to make the joint angle smaller. So if we're talking about flexion of the shoulder, that means we're going to raise our shoulder up towards our face. We're making the joint angle of the shoulder smaller. For extension, we're going to make the joint angle bigger. So for the shoulder, extension is bringing the arm away from our face or behind our back. Abduction would be to move away from the midline. So if we were talking about abduction, that would be moving out or away. Similar to like if somebody is kidnapped, they're moved away from their family. Abduction is the body part being moved away from the midline of the body. Adduction is being moved toward the midline of the body, so toward the belly button, say for instance if it's the shoulder, or the hand if when we're talking about the shoulder. More general directional terms would include internal, or you may have heard before, medial rotation. I use internal rotation because I find it less confusing. If we're talking about the shoulder, that would be an internal rotation would be moving the hand toward the stomach. Interestingly, if you internally rotate your hip, we're talking about which way your knee is going. So your knee would come towards your midline and rotate in. But if you had your knee bent when that happened, it would look awkward because your foot would come out. So don't get confused with that. With the hip is what the knee is doing. The knee is rotating in. So for external or lateral rotation for the shoulder, the hand would come away from the stomach. If we're talking about external rotation of the hip, the knee would come away from the midline. It would go outwards into external or lateral rotation. When we're talking about circumduction, that means to rotate in a circle. So we can circumduct our shoulder, we can circumduct our thumb, we can circumduct our hip. I guess technically we could circumduct our neck, but we can't circumduct every body part necessarily. Directional terms for the ankle include dorsiflexion, that's bringing the toe up towards the face, and plantarflexion, that is pointing the toe down. When some people might use the term of extension of the ankle or flexion of the ankle, if somebody uses that term, extension of the ankle is actually dorsiflexion, and flexion of the ankle is actually plantar flexion. So don't get those too confused when it comes to those other terms, but usually we use dorsiflexion for the big toe coming up towards the face and plantar flexion for the big toe going down towards the ground. More directional terms for the ankle include inversion, which is basically twisting the foot in or twisting the big toe in towards the shin, and that can cause injuries. But so can eversion, or twisting the foot out, so the big toe would come out away from the shin. Directional terms for the wrist include radial deviation. That means to move the whole wrist towards the thumb side of the wrist. And ulnar deviation, that means to move the whole wrist towards the pinky side of the wrist. And normally we go a lot farther with radial deviation than we do with ulnar deviation. Pronation would be turning the wrist so that the palm was down, or turning the forearm so that the palm is down. Supination is rotating so that the palm is up. I remember this most easily by remembering that if I'm supinated, I can hold a bowl of soup in my hand because my palm is up. Just a quick general overview of the human skeleton. We will talk more about the parts that are super important to us as we go through the different injuries to the different body parts. But we have, in our class, we'll start at the foot and ankle. So with the foot, the toes are called phalanges. The middle of the foot is called the metatarsals. The ankle bones that actually extend a little bit forward from our shin are called tarsals. Our shin bone is called the tibia. Our very small bone that is next door to the tibia in the lower leg is called the fibula. There is no such thing as a tibula, okay, just so we're clear. A tibia is the shin bone. The fibula is the small skinny bone next door to the tibia. Our kneecap is our is our patella. Our femur is our thigh bone. It is the strongest, longest bone in our body, or strongest long bone in our body, at least, excuse me. Next in class, we will be going over the shoulder. So our shoulder blade is called our scapula. Our collarbone is technically known as the clavicle. Our upper arm bone is the humerus. Our forearm bone that is on the thumb side is called the radius. Our forearm bone that is on the pinky side in anatomical position is called the ulna. Our wrist bones are called carpals. So the hands and feet are very similar, but the names of the bones are a little different. So the ankle has the tarsals, the wrist has the carpals, the hand also has metacarpals, like the foot has metatarsals, and our fingers are called phalanges, just like our toes are. We, generally speaking, have the same number of bones in our hands and in our feet. We will also be discussing the thorax, spine, and pelvis in class. So our pelvic bones are the big elephant ear looking bones that some people would consider, the top of your hips. And then we also have our sit bones. It's a part of the pelvis that's called our ischium. And then our pelvis attaches to the sacrum, which is the bottom part of the spine. The top part of the spine is the cervical spine. The middle part of the spine is the thoracic spine. And the low part of the spine is the lumbar spine. And we'll go over that more during our spine lecture. But each individual spinal bone is called a vertebra. And we also, with the thorax, have our ribs and our sternum. We will also go over some different parts of the skull, including the upper jawbone, which is called, it's called the maxilla, and the lower jawbone, which is called the mandible. As far as muscles go, some of our important muscles of the lower leg are the gastrocnemius and soleus. So the gastrocnemius is the most external large calf muscle. This is the muscle you'll see if you point your toe. Some people who really want to look really ripped and muscular will get a calf implant if their gastrocnemius is really small. So that gastrocnemius is the calf implant muscle. The gastrocnemius can point your toe and bend your knee. The soleus runs a similar pathway as the gastrocnemius, but it's a big flat muscle. It's more for muscular endurance than explosive movements, and it only points the toe. It does not cross the knee joint to flex the knee. Those are both on the back of the leg. The peroneals, sometimes known as the fibularis muscles, are on the lateral side of the leg, or the outer part of the lower leg. The tibialis anterior is on the anterior portion of the lower leg. Important muscles and tendons of the thigh would be the quadriceps. So the quadricep muscle group is on the front of the thigh. There are 4 quadricep muscles. Quad means 4. We have the quad tendon, which is superior to the patella or above the patella or kneecap. We have the patellar tendon, which is inferior to the patella or below the kneecap. We have our hamstrings, which are on the back side of our thigh. So we have 3 hamstrings, and there are 3 letters in the word ham. So that's just some easy little ways to remember that. Important muscles of the hip joint are the groin muscles, or adductors, so they pull the legs together. Those will be on the medial side of the thigh and hip. Our abductors, or muscles that pull the leg out away from the other leg, are on the lateral side of the hip. So this would be like our glutes, and one of our little hip flexors is also an adductor. Other muscles of the hip include the hip flexors. So the hip flexors would be more on the front side of the hip. So things like the iliacus and the psoas and the rectus femoris all help to flex the hip. On the back side of the hip and thigh are the hip extensors. So hip extensors would be like the glute maximus, and the bicep femoris, one of the hamstrings, can also help extend the hip. So muscles of the shoulder that are pretty important are the biceps brachii. This is on the anterior arm. The bicep will flex the elbow and the shoulder. The triceps brachii is on the posterior surface of the arm, and it will extend the elbow and the shoulder. The rotator cuff is muscle group is deep inside. You cannot easily touch the rotator cuff. Sometimes people get the rotator cuff and the deltoid somewhat confused, but the rotator cuff muscles are deep inside to most of the muscles in the shoulder. We have 4 rotator cuff muscles that spell out sits. So it's supraspinatus, infraspinatus, teres minor, and subscapularis. We'll go over that more in the shoulder lecture. Our very superficial muscles of the shoulder would be the deltoid. So that's when somebody has a very muscular deltoid muscle, it almost looks like they have a padded cuff on their shirt, like a short sleeve shirt with a padded shirt sleeve. So the deltoid is very superficial. The pec major is very superficial. The deltoid will help to raise the arm in every direction, and the pec major helps to horizontally adduct the shoulder and also helps with pressing type motions. As far as muscles of the forearm, our wrist and finger flexors come from the medial side of the forearm. So all of the actual muscles that go down to move your fingers come from the forearm. And then the tendons will run all the way down to the fingers. Our wrist and finger extensors are on the lateral side of the forearm. So all the muscles that extend the wrist or bring the wrist back are on the lateral side of the forearm in anatomical position. Muscles of the torso, in very general terms, include the spine extensors. So these will attach to the posterior spine and the pelvis. So that the spine extensors would be things like the latissimus dorsi and the multifidus, which is deep inside. Our spine flexors attach to the anterior ribs and pelvis. So those would be our abdominal muscles, say for instance, and our psoas muscle, which is also one of our hip flexors. So the spine flexors are in the front, the spine extensors are in the back of the torso.